Oh, hi. Welcome, 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 welcome. Please come in, come in, come in, come in, come in. All right. You may take a seat, take a seat. So today we're here for your cranial nerve examination. Yeah, so it's a neurological examination to test the functionality of your cranial nerves, which come from the brain. Now, of course, I must introduce myself. So, hi, my name is Shivy, but you may call me Quiet. Alright, and of course, please tell me your name. Lovely, perfect. Now, did you find it here okay? Yeah, I know sometimes they're a little difficult to find, but most people get here in the end. And we've got a new reception girl on staff at the front desk. Did you find everything okay with her? Okay, because she's on probation at the moment, so we're just taking patient feedback to see. So we'll have to see how that works. All right. So yes, your cranial nerve examination. Now, have you had one of these before? Well, it's very important that you do have them occasionally, just because we just check the health of your face, and that, of course, obviously all the nerves that are working, because they connect everything from the brain to your neck and vice versa, of course. So now, all right. So now that I know your name, just to check against the records. So could you just let me know your full name? Okay, alright, yeah, that's exactly what reception told me. And could you confirm your date of birth? Perfect, thank you. Alright, now that that's all out of the way, before we begin, of course, I need your consent, because there will be elements where I will be touching you, touching your face, moving things around. I will be shining a light in your eye. Shining a light in your eye. Yes, so now, is that okay with you? Alright, perfect. Alright, so now just relax for this. We're at eye level, so that's perfect, because I will be just analysing your face. So all you have to do is just listen to what I say, and just relax. Most people say this is actually very enjoyable, and they almost wish they could come back again. So I really hope that that is the case for you, my friend. All right. So now with the cranial nerves, there are 12 cranial nerves. 12. And there are 9 components to this test. So a couple of the components, couple of the tests basically assess multiple of these cranial nerves if they're all working correctly. But now there's nothing to be worried about. It's just to see what's going on with you. So most people get very nervous, but there's absolutely no need at all. So, and we've got best technology here as well, if any further treatment at the end is required. Okay, yeah, so just relax and just really enjoy it. Okay. And I just want to ask as well, are you experiencing any pain in the body anywhere? All right, that's good to know. Now, I just need you to stay very still. I just have to look at the symmetry of your face. Yes. It's not because we want to change anything, but it just is very telling about things that are going on in the body. No one's face is symmetrical, but I'm just looking for anything obvious that may stand out. All right, so just stay very still. And just look at me. Look. All right. Just gonna... All right, very good. Alright, so now we will examine the first cranial nerve. Alright, so the first cranial nerve that we are testing is the olfactory nerve. So I just want to ask if you have noticed any change in your sense of smell. Alright, now I'm just going to do a simple test. So I'm just going to block one of your nostrils. Yeah. Alright, and I've just got some mints here. So I'm just going to open this. Alright, I'm sure that tickles a bit, but it's fine. Alright. And can you smell that? Can you smell that? Alright. Now the other one. Sorry, I don't mean to stick my finger up your nose. Alright. Got that. And can you smell that? Alright, good. Because sometimes as we are aging, our sense of smell starts to change. Sometimes it starts to weaken, or certain smells may be amplified and really heightened. Also, smoking can have an effect. Are you a smoker? Yeah. Alright, now on to number 2. You'll notice as well that I am doing some interesting triggers and movements that I'm also assessing as well, because sometimes it's easiest to do it when people aren't paying perfect attention. That's the tell, because sometimes people focus too hard and I don't see the natural movement of their facial features and nerves. Alright, now firstly I'm just going to be looking at your pupils. Alright, I'm just going to have a look at the size and the dilation. Seeing how big they are. Now, do you wear glasses or contacts? Have you had a eye test recently? I would definitely recommend that. We say to do at least annually, once a year, that's all. Once, not twice, just once. Yeah. Okay. Alright, now we're beginning to do the visual field test. I'm just going to be analysing the 4 quadrants of each eye just to check that the vision is correct in all 4 of them. Yeah. Okay, so firstly, I will be moving a finger from outside to inside. I will actually probably just move my hand, and once you see the tip of my nails in your peripheral vision, you're going to say now. Yeah, alright. Okay. Now. Very good. I'm just going to do the other one. Just going to go a bit closer. You're doing very, very well. You actually have really good reaction times, basically. So I think your vision in terms of that is working very, very well. Okay, now I'm just going to be putting up fingers on the sides of your face, and basically you're going to count how many fingers altogether that I am holding up that you can see. And I'm just checking that you can see all the numbers, my fingers, the amount correctly. And it's just, yeah, a reaction test as well. All right. Very good, very good, very good, very good. Alright, now we're going to be doing some triggers with a bright light. I know some people find this a little bit uncomfortable, but I'm hoping you find it okay. So, that's alright. Perfect, thank you. I will try and put it on dimmer setting so that it's not too bright for you, okay? Alright, let me just switch it on. See, it's not too bright, okay? Alright, now all you have to do is just look straight ahead. Look almost like past me, like through me. Or you just pick a space on the wall behind. Alright, this one you really don't have to do anything at all. Anything. I'm just going to be shining a light in your eye and just seeing how your pupils react. There's nothing you can do or control or anything. So just relax. You're doing really, really, really well. Just keep focusing either on me or that spot on the wall. Just gonna put my hand there. Yep. Alright, now I'm just gonna do your other eye. Alright, and yep, just find that spot again. Alright, very good, very good. Now we're going to do what's called the swinging light test. It's just that all I'm doing is, as it sounds, I'll be swinging the light between both of your eyes, and just to see the reaction, if it is what I am looking for. Okay, stay very still. You're doing super, super well, okay? Alright. Almost done. I know some people's eyes do start to water when we do this. Alright, all done. Alright, I promise that there's no more with the light, okay? Alright, let me just switch this one off. Perfect. Alright, now we're going to be testing cranial nerves 3, 4, and 6, and basically these just test your eye movements. So now, have you ever experienced any double vision? Any other issues with your eyesight? Okay. So now this one is basically all you have to do is just follow my finger, okay? And again, I'll just be testing those 1, 2, 3, 4 quadrants of each eye. Alright, now I won't be going too fast for this one, so I don't want to mess your eyes up too much because I know they're probably quite sensitive from shining all the bright lights in it, okay? So, alright, now just... Now just make sure you keep your head still. Yeah, because we're just your eyes, so you can't move your head, okay? Alright, let's try again. You're doing very, very well. Alright, you've done well. Alright, just take a break. Close your eyes, close your eyes, close your eyes. Yep. Just relax, just relax. Keep closing them. Just let them settle a little bit. Sometimes it does get a little bit overwhelming doing all of these things. Alright, and now you can lift them open. Alright, does that feel okay? Perfect. So the fifth cranial nerve tests your facial sensation. So basically what I'm going to be doing is touching different points on your face, but instead of doing it with my finger, I'll be doing it with a tiny little Q-tip. And because it's so tiny and delicate, that basically tests like how sensitive your face is. So obviously if I'm going to be doing this, you can tell what I'm doing, so I will need you to again to close your eyes, which I'm sure you're very happy about. So yeah, close. Perfect. Alright, so what all you have to do, just keep your head very still as you're doing an excellent job. And I'm just going to be touching elements, and all you have to do is say now when you feel it, and then I will simply move on to the next area, okay? Sorry, did I shock you there? Didn't mean to, sorry about that. Alright, let's try again. Alright, very well. You did super good, okay? Now, did it feel the same on both sides of your face? Okay, good. Okay, so next we will be doing number 7, which is to check the facial nerve and your facial expressions. So different movements you can do with your face, such as raising your eyebrows. Okay, so just raise your eyebrows and hold. And release. Alright, now close your eyes and squeeze them shut. Alright, don't let me open them. Alright, great. Now I'm going to get you to puff out your cheeks. Alright, and hold them there. Don't let me push them in, don't let me push them. Great. And then I just want you to purse your lips like this. And hold. And release. Feels like a bit of a workout for the face, doesn't it? Alright, you're doing really well. Now we're going to move on to the next one. So now we're going to be doing number 8. Which is to do with your hearing. So have you noticed any changes in your hearing recently? Alright, so now what I'm going to be doing is covering one ear and then whispering in the other one. I'll be either saying a word or a number, and you just have to tell me what you hear, okay? Alright. As usual, just stay very still like you're doing. Alright, let me go to that one. 55, great, yep. Alright. Buttercup. Yeah, you're doing really well. So, yep. And just two more. Perfect, 21. And last one. That one is a little harder. It was quiet. But you're doing very, very well, okay? All right, now we're just going to be doing cranial nerves number 9 and 10. 10 being the vagus nerve. Okay, so firstly, just stick out your tongue, and all you need to do is say ah, 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 like that. Okay, very good. Now I'm just going to give you some water, but before that, I just need you to do a little cough. So go, and you'll go. All right, now I'm just going to give you some water. So we'll take a sip. And swallow. But I just want you to hold it for just a little bit, a couple seconds, right? All right, here you go. Have a sip. Hold. Swallow. All right, I'm just looking at your neck and your swallowing pattern there. Just gonna have a sip myself if that's all right. You're doing so well. We're almost at the end. Remember, there are 12 cranial nerves, okay? So, almost there. Alright, so number 11 is the accessory nerve. I'm just going to be testing your head and sort of basically your power in it. So again, this is one of those exercises where you will need to resist the pressure that I'm placing on your face. Alright, I'm just going to hold your face. Alright, and I'm going to attempt to turn it this way. And you're going to resist. Alright, 3, 2, 1, and resist. Very good. Alright, now we're just going to do in this direction. So, alright, and 3, 2, 1, and resist. Perfect, you're doing so well. And I think you're a bit more comfortable now as well. Yeah, most people do find it quite like relaxing. They do like it, sort of the personal tension that just naturally comes with this type of neurological examination. All right, and almost sadly, we are near the end. We are on to number 12. You've done really well. I don't see too many issues or anything that you'll need to worry about. But let's do the 12th one first before I get too ahead of myself. All right. So the 12th cranial nerve is the hypoglossal nerve, and this is another one that involves your tongue. So, all right, just stick it out. Yep. And just relax your jaw a little bit. All right, you can close your mouth now. Just swallow. All right, and we're gonna do it one more time. So stick your tongue out. All right, and close. Swallow. Yep, you're doing very well. Okay, I know I keep saying that, but you really are. Alright, and now we're going to do another little exercise with your tongue, and this is the final one, okay? So I'm just going to put my finger just on your cheek. What you're going to do with your tongue is just press against it, okay? And you do it on both sides. Alright, so we'll do this side first. Alright, and put your tongue out. Press. And release. We'll do the other side. Alright, and just press against my finger. Alright, and we'll just do this one again. Just need to check something. And okay, yeah, no, that's fine, yeah. Sometimes there's a couple abnormalities, but yeah, no, you seem fine. It is a bit of a weird sensation, definitely. We shall email you your report from your cranial nerve examination today. Did you give your email address to our front desk girl? Okay, perfect. We will let you know if you do need any further testing, such as an MRI or a CT scan, but just based on my assessment today, I think everything has gone super well, okay? Alright, did you have any questions about anything? Okay. Alright, now you take care of yourself, okay?